Good morning, everybody, and thanks for the chance to chat with you this morning. And also thank you to ESTHER. They've been fundamental in the work of Operation Childlife, and particularly this project in getting my course up and running in Muhimbili Hospital in Dar es Salaam in Tanzania. So we're going to talk about the PASS course. This is the Paediatric Acute Surgical Scenarios course in skills. It's a course that we've been running for a few years in Vietnam, but we're now going to be taking it to Africa for the first time. Along the bottom, you can see the different charities that we're affiliated with, that we work with. IPSAC, which is a Vietnam children's-based charity. Christina Noble charity, another Vietnam-based charity. Comhlámh Hospital, which is my hospital out in Bahrain. I'll mention that in passing in a bit. RCSI, both here in Dublin and, of course, in Bahrain as well. So this is the things we're going to go through, and just mentioning some of our other global partners there that help make everything we do possible. Very quickly, those of you who have listened to my accent will have realised I'm from a bit further north than Dublin. I'm in fact a Nordy. I'm standing here at the Royal College of Surgeons in Ireland. So I didn't stay there long. At 18 I left, did my med school in Scotland, then post-grad training in England before leaving via Iraq and post-war Kurdistan to Oman. Then the last 10 years I spent working in Bahrain. As a consultant anaesthetist in King Hamad University Hospital, senior lecturer at RCSI Bahrain, TV presenter, and working with Operation Childlife as well. So what is Operation Childlife? Now, Operation Childlife is based here in Dublin. It's an Irish charity that was formed a couple of decades ago, initially as a very small charity, set up at the request of the Children's Hospital in Ho Chi Minh City to go out and provide some help and support and education, really, in providing complex surgical interventions in children. So really, it's grown over the last 2 decades, and we've now got projects going in Tanzania where we've got a long-standing base. We've also started doing other projects in Mongolia and Jordan over the last few years. Now, this work's really only possible not only to the help of people like ESTHER and our other partners, but to the commitment of 100+ consultants that have helped us and traveled as volunteers to all our different countries and conducting some incredible surgeries over the time. So what we do, we provide pre-operative care. So that means, we give them help with virtual ward rounds, support with pathology, diagnosis. They can send things and get them diagnosed and whatnot here in Ireland. We provide surgical support, and along with that surgical support, it's really important we provide the training. It's not just go in, do incredible surgery, fly back to Dublin. It's training the local surgeons up during those surgeries that they can in fact do them whenever we're not there. Then, of course, post-operative support for these children. That's not only in the doctor level, but that's nurses as well. So perhaps taking out intensive care nurses to look after these children. So it's guidance, training, and education for all these things. So the countries that we work with, hopefully we're going to get them up to a much higher level. And with Vietnam, we've seen them really progress, particularly in the cardiac area. They're almost self-sufficient. It's incredible. And we've been supporting throughout these countries in many different specialties. You can see from the list there, we pretty much cover all pediatric surgical specialties. But why do we need PASS, this pediatric acute surgical support and skills? Well, whenever we look at low and middle income countries, they have a disproportionate burden of childhood mortality and morbidities. Whenever we looked at the WHO figures, 90 to 95% of these deaths, traumatic deaths in children, were in the low and middle income countries. And those of you that have been in these countries will not be surprised. You see what it's like in Africa. You see what it's like in Vietnam. You go out onto the road just to cross it, and this tsunami of scooters comes at you with entire families on them. The potential for trauma is just everywhere. Even cooking dinner over an open fire or a kerosene fire at home, it is just everywhere. So there's a vast need for this. There's huge gaps in the clinical staff's readiness to get acutely involved in kind of pediatric trauma. And there's really been no teaching existing in these countries before us. So the training opportunities have really been lacking. Whenever we look at PASS, we want to provide the caregivers in these countries with the skills to provide that immediate life-saving ability, really, because it's all about getting kids in that golden hour. Whenever they come in with a trauma from a burn or whatever, the sooner you can get them, the sooner you can recognize this and initiate care, the better. So the course, it's based on this premise that the initial assessment, recognition, and early appropriate management of these life-threatening emergencies makes a huge difference, okay? And a lot of these places where these kids present, they don't have the surgical skills to do it. So it might be recognizing this in ED and going, you need to get out of here and get to the big hospital in the city, as opposed to letting them languish in the peripheral hospital, okay? Or maybe you're in that big hospital and you recognize this kid's got a head trauma, they need a neurosurgeon, but recognizing these things. So the course itself is a mixture of things. There's some didactic teaching on pediatric and neonatal surgery. We've then got workshops. That's things like putting in chest drains, airway maintenance, recognizing when you need to provide a surgical airway and things like that. We also have a lot of scenario-based teaching, that's simulation teaching. Any of you that are involved in medical teaching and education these days will know how important simulation is. Simulation teaching at RCSI is brilliant. We have a high-fidelity simulation lab. It's awesome. We've got the same in Bahrain. I'm so blessed. Teaching that in Vietnam or in Tanzania is very different because you do not have this high-tech surroundings that we have here. So it requires a lot of initiative and enthusiasm and inventiveness on your part to convey that message across and engage the students and learners. Okay, but does it work? Okay, so we looked at some pre and post exam scores. So whenever everybody comes, they do a written exam at the start, they do a written exam at the end, we score them on their initial simulation performance, and we score them on their final day's simulation performance. And that simulation performance is assessed as a team. Many of them, pretty much the same way as we do with the American Heart Association teaching now, we assess people's life-saving abilities as part of a team group, okay? And you can see from the numbers here that we really made a significant increase in their pre and post-course scores. Also, we had a huge satisfaction from the learners as well. So what did I find whenever I did it in Vietnam? This was challenging. Okay, a number of reasons why. Okay, it's different cultural aspects that make it different. Okay, they don't speak my language. I speak English. I speak a little bit of Arabic, but I do not speak any Vietnamese. So you have to do everything twice. So it takes twice as long to do everything. And you've got time constraints in this course. Like every course, you've got 15 minutes for me to tell you this little story now, so we can move on. So it takes twice as long to do everything. Then you've got huge differences in the culture. Anyone that spent time in the Far East will know how respectful and polite and quiet people are. And they've got this huge respect for the medical hierarchy. So it's very different to an Irish nurse who's very empowered, very enthusiastic, and not shy about saying what she thinks, okay? These nurses are so respectful of the doctor, they will barely, answer a question, and that's very obvious, and if they start the sim work, they just stand back and are quiet. So that's the hierarchical things, and this all affected how they started learning at the start. So we had to change how we taught to be incredibly engaging, to bring these different personalities together. Okay, and by the end of it, you could really see from day 1 to day 3.5 a huge difference in how the team worked, and it was just incredible. So we've been running it successfully for many years in Vietnam, but what we decided to do is we've got this stable base that we've been working in for years at Muhimbili Hospital in Dar es Salaam in Tanzania. Let's take the course there, because whenever you look at the statistics, there's a real need for teaching there on management of acute pediatric surgical emergencies. Children less than 15 make up a huge proportion of the population. That's 41.1 million out of the 67%. And almost 25% of the trauma admissions that come into hospital are children's. That is a huge weight on the hospitals of pediatric traumatic emergencies. Mainly that falls on RTAs, and that's not really surprising. You look at these pickup trucks just full of families and children, it's not surprising the amount of RTAs. Whenever they looked at the child mortality coming into pediatric surgical care units, it was truly catastrophic. It was 25%. Whenever they looked at that 25%, 42.9% of that was in the first 24 hours. So it's scary thinking about a child going in having a 1 in 4 chance of dying. So there's a real need to teach the recognition of that acutely ill surgical patient how to intervene and make the difference in that golden hour at the start when we have the chance. So what am I doing about it, or what are we doing at it, is Operation Child Life? Well, next week, starting on Tuesday, I'm taking a team out to Dar es Salaam to teach this course and replicate what we've been doing in Vietnam. So I've got a mixed faculty from IPSAC, the Vietnam-based charity, from Operation Child Life, based here in Ireland, and King Hamad University Hospital in Bahrain. And what I did in the interim, I ran the course, the PAS course, out in Bahrain, so I could train up more faculty members, because you can't run it on a bare minimum staff because you've got different availabilities. So I ran the course again to up my faculty members, so I've got a bit of flexibility. So we're going to do it at Mahambili National Hospital for Children in Dar es Salaam. This is quite a big hospital. It's a 1,500 bed capacity and sees about 2,000 outpatients per day. And we've got our group of learners put together. The hospital assembled them for us. And this is a mixed group, okay? If you're going to run a course like this, you need a mixed medical professionals. You need nurses, you need surgeons, you need physicians, you need anaesthetists, you need everybody that makes up the team, because we work as a team, we play as a team together, recognizing these traumas in the ED. So you need everybody to be there together. So that's what we've put together. I think you saw on the slide earlier the proportions of surgeons, anaesthetists, and nurses that make up the course. So that is where we've come to with the PAS course, something that was developed in Vietnam because we recognized the need for a course that was different from existing things like PALS and ATLS, and made something new that was particularly relevant for children in this part of the world, validated it in our Vietnamese medical professionals group, and are now taking it through to Dar es Salaam, where we've got a nice established base and recognize the need that we've seen over the years. There's a couple of interesting articles there we've got in the PAS course, so you can read a bit more about it in detail, and just another one there on paediatric trauma. Okay, down there at the bottom you can see the different people that we work with to make all the work that Operation Child Life does possible, and of course a huge thank you to ESTHER, particularly from Mahambili Hospital Project. Without them, this wouldn't be happening. Thank you.